Hello to everyone, my name is Luis Montalvo and I'm a med student at the Universidad Católica de Santiago de Guayaquil. Today's topic is MERS complications, and so first, here's my personal info so you can follow me on Twitter, YouTube, and Facebook. And also, my Instagram account is Luis Montalvo 12. So you can watch in these four platforms. You can watch the other videos I uploaded. I hope you like them. I just uploaded a video yesterday in which I talk about bipolar disorder, so enjoy it. Now, MERS complications. First, what is the definition of MERS? MERS is the Middle East Respiratory Syndrome, and it is a respiratory illness caused by an infection with the MERS coronavirus. Now, here's a video, and enjoy it.
MERS-CoV, or Middle East Respiratory Syndrome coronavirus, is the latest little-known virus to be making headlines globally. Symptoms include fever, cough, and shortness of breath. For many, those symptoms are followed by more severe complications, such as pneumonia and kidney failure. The World Health Organization estimates that 36% of infected patients have died from MERS. The first confirmed case was reported in Saudi Arabia in 2012. Contact with camels is believed to be the source of many human infections. Since then, cases have been reported in over 20 countries, including the US, Europe, Asia, and Africa. More than 1,200 people have been infected, of which more than 440 have died, with the vast majority of those deaths occurring in Saudi Arabia. Recently, MERS has infected close to 100 people in South Korea, with nearly 3,000 people in quarantine. However, that large number is primarily attributed to poor infection control within hospitals. Further spread of the virus could take a toll on South Korea's economy, the way SARS did throughout Asia a decade ago. Most at risk is the tourism industry, which accounts for 5.8% of the country's economic output. In fact, the Korea Tourism Organization reported about 25,000 people had already canceled trips to South Korea this month.
Well, I must mention that this video was posted 5 years ago in 2015, so when the person in the video says today, he is really referring to the year 2015. Now, with that said, let's hear the definition of coronavirus. Coronaviruses are a large family of viruses that usually cause mild to moderate upper respiratory tract illnesses, like the common cold. There are hundreds of coronaviruses, most of which circulate among such animals as pigs, camels, bats, and cats. Sometimes those viruses jump to humans, and that's called a spillover event, and can cause disease in humans. 3 of these coronaviruses can cause serious and even fatal disease, which are SARS, MERS, and COVID-19, which is SARS-CoV-2 actually. That's the name of the virus, SARS-CoV, and the disease is called coronavirus 2019. Now here is another video.
COVID-19 has fast become a deadly global epidemic, but it's not the first time a disease of this nature has spread across the globe. It comes from a large family of viruses called coronaviruses. Some cause nothing more than a cold, but others can be much more serious. In late 2002, a coronavirus known as Severe Acute Respiratory Syndrome, or SARS, swept across southern China, causing severe pneumonia that quickly spread to other countries. It infected more than 8,000 people and killed 774. Its symptoms included headaches, muscular pain, and a dry cough. In 2012, another coronavirus named Middle East Respiratory Syndrome, or MERS, began affecting people in Saudi Arabia. The World Health Organization counted nearly 2,500 cases of MERS and more than 850 deaths. All 3 coronaviruses are believed to have originated in animals. Scientists say most of their RNA genomes, that is, their basic molecular structures, are the same.
The RNA genome is about 82% identical as the SARS virus. That's good news because then the experimental inhibitors that my group and other groups have developed will work also against the new Wuhan coronavirus.
The challenge now is to identify the precise genetic differences between this new strain of coronavirus and SARS and MERS. That involves a scientific process known as genome sequencing. It's something that's already being worked on.
We really need to understand this virus. Of course, where it originated and how it jumped to humans, but also about its transmissibility, the age groups that it affects, what are the underlying conditions.
So far, around 14 genetic sequences for the virus that causes COVID-19 have been identified, but there may be more. This information can be used to create a vaccine. That's something that could take months or even years. But the good news is, with time, the human body can become immune to most coronaviruses.
These RNA viruses are self-limiting. That means after a certain time, most people have developed antibodies against the virus, even though they did not fall sick, and then they are immune against the infection.
SARS eventually disappeared, but MERS is still around. It causes a small number of infections every year. If scientists can't fully sequence the COVID-19 genome or come up with a vaccine, there's a chance that it may not go away either. Shamim Chowdhury, TRT World.
Now, application in medicine. Between September 2012 and January 2017, the World Health Organization received reports from 27 countries of 1,879 laboratory-confirmed cases in humans of the Middle East Respiratory Syndrome caused by infection with the MERS coronavirus, and at least 659 related deaths. Dromedary camels are considered to be the most likely source of animal-to-human transmission. Now, clinical manifestations. The incubation period of MERS is 2 to 13 days. Incubation period means the period of time between the day you were infected with the virus and the day that you start presenting symptoms. So this incubation period is 2 to 13 days. Now, common findings. These are fever with chills or rigors, cough, shortness of breath, hemoptysis, sore throat, myalgias, diarrhea, vomiting, abdominal pain, and abnormal chest radiograph. Most reported patients with MERS-CoV infection have been adults with severe pneumonia and acute respiratory distress syndrome, and some have had acute kidney injury. Many patients have required mechanical ventilation, and some have required extracorporeal membrane oxygenation. Other complications include pericarditis and disseminated intravascular coagulation. Here's another video.
To know about MERS-CoV. What is MERS-CoV? It's the Middle East Respiratory Syndrome coronavirus. First reported in 2012, this strain of coronavirus causes acute respiratory illnesses in affected patients. While most cases have occurred in the Middle East, the virus has spread to other countries. There are two possible ways of transmission: from exposure to infected animals or humans. Those in close contact with infected patients have a higher risk of infection. Currently, there has been no evidence of sustained human-to-human transmission in the community or airborne transmission. What are the symptoms? They include fever, cough, and shortness of breath that might progress to a more severe acute respiratory illness. Here are some ways you can protect yourself and others. Observe good personal hygiene at all times. Wash your hands frequently. Wear a mask in crowded places and seek medical attention if you become unwell. Avoid consuming unpasteurized milk, undercooked meats, and eggs. Avoid contact with camels, poultry, birds, and other animals. Avoid close contact with persons suffering from acute respiratory infections. For now, there is no known cure, vaccine, or any specific antiviral treatment. Infected patients can get medical help to relieve the symptoms. The Ministry of Health and healthcare institutions have measures in place to monitor the situation and contain the spread of the virus should it emerge in Singapore. If you become unwell within 2 weeks of visiting countries with reported cases of MERS-CoV, wear a surgical mask and seek medical attention promptly. Inform your doctor of your travel history. For more information, visit this website for the latest health advisory.
Pros and cons. Now, the only pro is that human-to-human transmission is limited, and that's a big difference between MERS-CoV and SARS-CoV-2, because SARS-CoV-2, the one that causes coronavirus 2019, is highly transmissible, and that's why there are over 1 million people infected currently. While this MERS-CoV virus is not highly transmissible. The human-to-human transmission is limited. Cons is that the case fatality rate is very high. It's over 34.4. And 89% of the people that present symptoms require intensive care, while 72% require mechanical ventilation. Issue applied in Ecuador. Well, there are no records of MERS cases in Ecuador, but here's a video in Spanish so that people that is watching this video can understand what I'm talking about. Conclusion. Due to high probability of requiring intensive care and mechanical ventilation and the high case fatality rate, an early diagnosis and treatment is very important to save patients infected by MERS-CoV. And here's a final video.
Alarm, but how much do we really know about it, and how does it compare with other coronavirus outbreaks? VGTN's Gerald Tan takes a look.
This new coronavirus is identified as the 2019 nCoV. Its symptoms can be similar to a common cold or flu, coughing, fever, and shortness of breath. Current statistics show that about 2% of those infected with this virus have died. Now, in the past, we've seen 2 other serious human coronavirus outbreaks. The severe acute respiratory syndrome, or SARS, emerged in southern China in late 2002 and disappeared within 2 years. It sickened about 8,000 people worldwide and had a mortality rate of nearly 10%. And then there was MERS, the Middle East Respiratory Syndrome of 2012. Although it affected a much smaller group, about 2,500 patients, the symptoms were more serious and the death rate much higher, nearly 35%. The pace of infection is also a factor. MERS took about 2.5 years to infect 1,000 people. SARS, meanwhile, took 130 days to do the same, and the new coronavirus just 48 days. Researchers are now racing to find a vaccine.
There are no proven effective therapeutics for novel coronavirus. This epidemic, and if you look at the age and sex distribution, is predominantly causing severe disease and death in older patients, many of whom have underlying conditions.
Still, many doctors point out that the coronavirus outbreak is dwarfed by a much more lethal killer, influenza. The World Health Organization estimates some 5 million people around the world contract the flu every year, and up to 650,000 patients a year die from the illness. Gerald Tan, CGTN, Washington.